Hello and welcome to today's webinar. My name is David Goldberg, Agency Director with Lourie Life Health. Today is the first of our multi-part series on Medicare training, Chapter 1. A couple quick housekeeping tips. You should have a go-to control panel on the right-hand side of your screen. This is an open forum and we look forward to and encourage any questions and or comments that you may have. As they arise, where you see the arrow next to questions, please post them there and a member of our broker support team will answer the questions at the end of today's webinar. If you have any further questions after the webinar is over, simply pick up the phone and call us at 803-256-2067. Don't worry, if you didn't get that number, I'll give it to you again today at the conclusion of the webinar. All of our webinars are recorded, so if you missed any of today's or simply need a refresher down the road, you will find the recorded version in our Agent Partner Hub. Let's get started with today's exciting webinar. The agenda includes learning about the various parts of Medicare and the opportunity it presents, basic enrollment periods, and at the end, we're going to wrap it up with questions. The purpose of our Medicare and Health Bootcamp series is to give you the building blocks of Medicare and ACA in digestible 30-minute trainings. Here at Lourie Life Health, we train our agents to be portfolio-minded and to educate and empower clients to choose the plan that is the right one for them based on their needs. If you want to market to the fastest growing segment of the population, well, guess what? You're in it. If you can see the numbers on your screen, it used to be we had 10,000 people turning 65 every day. Well, guess what? For the next few years, we're over 11,000 people. Look at that opportunity. So if we go back a few years, 2000, we had over 35 million 65 and older members. You go fast forward 10 years, that number increased by another 5 million, so you're at 40 million. Looking just a few years ago at 2020, there were over 55 million members of the population that were 65 and older. And if you want to go a few years from now, that number is increased and forecast to increase by another 20 million. And then by 2050, that number of members in the population that will be 65 and older is somewhere between 88 and 89 million. That's a lot. That's a big opportunity. So let's talk about who's eligible for Medicare. What is it, right? It's health insurance for people that are 65 and older or under 65 with certain disabilities, such as ALS, also called Lou Gehrig's disease. They get that in immediately at any age with end-stage renal disease or kidney failure. There's a note. To receive Medicare benefits, you must be a U.S. citizen or lawfully present in the U.S., and you have to be here for at least 5 continuous years. We'll talk about that a little bit more. What you see here is an example of a graphic of what our agents use to show someone who's turning 65 or leaving employer coverage the options they have. That begins with you understanding and explaining the basics of original Medicare, to include what it covers and what it doesn't cover, the cost, and the 2 options they have: a Medicare supplement plan along with a standalone prescription drug plan, or a Medicare Advantage plan, also known as Part C. We'll discuss these a little bit further in more detail, but to start off with Part A, which covers your hospital insurance, if people receive a Medicare card, you'll see where it says Part A and it'll say hospital benefits, right? Well, Part A also includes skilled nursing facility, home health care, and hospice care. Part B is what most members use for day-to-day services. That's their medical insurance. That includes their normal doctor's visits, specialist visits, etc., outpatient hospital services they may receive, clinical lab tests, preventive services. There's a wide variety of all of those available. You usually don't pay a monthly premium for Part A coverage if you or your spouse paid Medicare taxes while working. This is sometimes called premium-free Part A, and it's handled through FICA, which is a United States federal payroll tax imposed on both employees and employers to fund Social Security and Medicare. About 99% of people with Medicare don't pay a Part A premium since they've worked at least 40 quarters or 10 years in Medicare-covered employment. Enrollees 65 and over and certain persons with disabilities who have fewer than 40 quarters of coverage will pay a monthly premium to get coverage under Part A. If you aren't eligible for premium-free Part A, you may have to buy it or may be able to buy it if you're 65 or older, and you have Part B and meet citizenship and residency requirements. Under 65, if you have a disability and your premium-free Part A coverage ended because you returned to work. In most cases, though, if you choose to buy Part A, you'll also have to buy Part B and pay monthly premiums for both. The amount of premiums depend on how long you or your spouse worked in Medicare-covered employment. Social Security determines if you must pay a monthly premium for Part A. In 2025, the Part A premium for a person who has worked less than 30 quarters of Medicare-covered employment is $513 per month. Those who have between 30 and 39 quarters of coverage may buy Part A at a reduced monthly premium rate, which is $285 a month. If you aren't eligible for premium-free Part A and you don't buy it when you're first eligible, your monthly premium may go up by about 10% for every 12 months that you did not have the coverage. You will have to pay the higher premium for twice the number of years you could have had Part A but did not sign up. So let's talk about Part A and what Part A covers. It does help cover your medically necessary inpatient services. So when you think of an inpatient hospital care, right, what do you receive? Well, you get a semi-private room. Part A also includes meals and includes general nursing and prescriptions, those drugs. It also includes other hospital services and supplies as part of your inpatient treatment. These are things, when you think of, you receive in acute care hospitals, critical access hospitals, inpatient rehab hospitals, long-term care hospitals, and other facilities, in psychiatric care in an inpatient psychiatric facility. But note that there is a lifetime limit of 190 days when you're in a freestanding psychiatric hospital. And inpatient care for qualifying clinical research study. This does not include private duty nursing, a television or phone in your room, and a private room unless it's medically necessary. A couple things to note here is that Medicare typically doesn't pay for your hospital or medical bills if you're not lawfully present in the United States. Also, in most situations, Medicare doesn't pay for your hospital or medical bills if you're incarcerated. They've got their own prison system. But if you're in the hospital as an outpatient and then are admitted as an inpatient, Part A coverage can be retroactive 3 days. All people with Part A are covered for inpatient hospital care when they meet these criteria. They're admitted to the hospital as an inpatient after an official doctor's order, which says, hey, you need inpatient care to treat your illness or injury, and the hospital accepts Medicare. And then in certain cases, Part A also covers inpatient hospital care if the hospitalization utilization review committee approves their stay while they're admitted. If you want to go to an inpatient skilled nursing facility, there is coverage as well. Note that this is not necessarily custodial or long-term care. That's not covered by Medicare, and we'll talk about that in a little bit. Skilled nursing care involves safe and effective care given by skilled nursing or rehab staff. This is skilled nursing and therapy staff include a great team of nurses, practitioner and vocational nurses, physical and occupational therapists, speech language pathologists and audiologists. Note that you must have a 3-day inpatient hospital stay first with original Medicare. This does not include the day you're discharged. If your doctor is participating in accountable care organization or other type of Medicare initiative that's approved for a skilled nursing facility 3-day rule waiver, you may not need to have a 3-day inpatient hospital stay prior to receiving coverage. Here's more detail about what's covered under Part A. Blood. See that. If the hospital receives blood from a blood bank at no charge, guess what? You don't have to pay for it or replace it. The hospital has to buy the blood for you. You've either got to pay the hospital cost for the first 3 units of blood you receive in a calendar year, or someone else can donate the blood. Hospice care. To qualify for hospice care, a hospice doctor and your doctor must certify you're terminally ill, which means you have a life expectancy of 6 months or less. When you agree to receive hospice care, you're agreeing to comfort care instead of care to cure your terminal illness. You must also sign a waiver or a statement choosing hospice care instead of other Medicare-covered treatments for your terminal illness and related conditions. Coverage includes all items and services needed for pain relief and symptom management, medical, nursing, and social services. You think of your drugs for pain management, DME or durable medical equipment for pain relief and symptom management, aid and homemaker services, and other covered services you need to maintain and manage your pain and other symptoms such as spiritual and grief counseling for you and your family. What else does Part A cover? Home health care. Medicare does cover home health services under Part A and or Part B, and it covers those services as long as you need part-time or intermittent skilled services and as long as you're homebound, which means you have trouble leaving your home without help, like you're using a wheelchair, a walker, a cane, crutches, other transportation. You're leaving your home isn't recommended because of your condition, and you're normally unable to leave your home because it's a major effort. So these are the costs you pay on original Medicare. The actual dollar amounts are updated annually, and for 2025, you've got a deductible and no coinsurance for the first 60 days of each benefit period that you're admitted to the hospital as an inpatient. If you're in there longer than 60 days, you have a copay per day or a coinsurance per day of $419, and that's days 61 through 90. And then after you're in there 90 days, at that point you start drawing from your lifetime reserve bucket. And there's a coinsurance or a copay of $838 per day, days 91 plus, until you exhaust that bucket. And you start with 60 days, and each day you're in there, it pulls one from that bucket. If you max out and exhaust those days from the bucket, at that point you're responsible for all costs. And reminder, we talked about this earlier, if you're in an inpatient mental health facility, you're limited to 190 days in your lifetime. And that's inpatient hospitalization. So let's say you go to rehab, skilled nursing facility. Again, the intent is to go home and not live in the skilled nursing facility, right? So this is rehab care. The first 20 days of each benefit period are on the house. After that, you've got a copay or coinsurance per day, and for this year, it's $209.50, days 21 through 100. If you're in there longer than day 100, you're responsible for all costs. And if you need home health care, you pay nothing for that, but you do pay 20% of all Medicare approved amounts for DME or durable medical equipment. And I want you guys to remember one thing on this slide. Let it be the Part A deductible. Everything else is a divisible number of that number. And I bet you guys thought I was the smartest person on this webinar. So let's talk about benefit periods on Part A. Benefit period refers to the way that original Medicare measures your use of hospital and skilled nursing facility care. A benefit period begins on the day you're admitted as an inpatient in a hospital or skilled nursing facility, and it ends when you haven't received any skilled care or inpatient hospital care for 60 days in a row. If you go into a hospital or skilled nursing facility after one benefit period has ended, a new one begins. So the Part A deductible applies for each benefit period. So there's no limit as to the number of benefit periods you can have, and they can span across calendar years. So let's talk about Part B premiums. This year in 2025, the standard premium is $185. That's going to be deducted directly from your Social Security benefits check, unless for some reason your benefits check is less than $185 or you're not receiving a check. Right? In that case, they're going to bill 3 months, so once a quarter, for 3 times the standard premium, unless you have a different amount that you owe. Some people that are on Medicare paid less than the full standard amount due to the statutory hold harmless provision. That provision limits an increase in their Part B premium to be no greater than the increase in their Social Security benefits. Remember, the premium may be higher if you didn't sign up for Part B when you first qualified for it. The cost of Part B may go up 10% for each 12-month period that the consumer could have had Part B but didn't sign up for it. In most cases, if you don't sign up for Part B premium when first eligible, you may have a delay in getting Medicare coverage in the future, and you may have to pay a late enrollment penalty for as long as you have Part B. You'll pay the standard Part B premium amount, so $185 again, if you sign up for Part B for the first time this year in 2025. You don't receive Social Security benefits. You are directly billed for your Part B premiums. Now, if you had a modified adjusted gross income as reported on your IRS tax returns from 2 years ago above a certain amount, which we'll get to on the next slide, if so, you'll pay above the standard premium amount because you're going to be paying the standard premium plus an income-related monthly adjustment amount. That's also called an IRMA, and that's an extra charge added to your premium. Again, that's on the next slide. One thing that we didn't mention is that if you have Medicare and full Medicaid, your state Medicaid agency may pay your Part B premium, which again is $185 this year. As we mentioned, most people pay the standard Part B premium amount, but if your modified adjusted gross income is above a certain amount, you'll pay an additional charge called an IRMA. It's not many people, roughly about 7% of the people on Medicare pay an IRMA. The total Part B premiums for people with higher incomes for this year in 2025 are shown on the chart here, right? So the base premium you see is for individual tax filers who file $106,000 of income in 2023 for tax year 2023, or if they file jointly, you're looking at about $212,000 or less. That's the standard Part B premium. So what you see here is your premium is always reflected based on what you made 2 years prior on taxes. And so, if you're an individual made less than $106,000 or married, filing joint, made $212,000 or less, you pay the standard rate. And if you file married, filing separately, you can see in the chart here, there are not quite as many categories available. You either pay one of 3 rates, right? And as you can see, you can graduate as people make more and more money, they pay a larger amount for their Medicare Part B, and that goes up from an individual up to about $500,000. Once you make $500,000 in a year, that maxes out. Again, this is for 2025. For 2026, 2027, those numbers may change, and the amount of the premium associated with those numbers may also change. In addition to your premium, there are some other costs that you would incur for Medicare Part B. There's a deductible. You pay that once a year. So if you look closely, Part A had a deductible that was once per benefit period. Part B has an annual deductible. Once you've satisfied that, you don't pay the first dollar per se, right? Instead, you pay a co-insurance. Medicare hasn't changed that amount since its inception in 1965. Medicare pays 80% of all covered services. You, on the other hand, pay the other 20%. And again, this is for Medicare assignment. So, the doctor may want to charge something, and if they accept Medicare assignment, the charge is going to be significantly less than that. And then Medicare pays 80%. You pay the other 20%. And then, as you can see here, you don't pay anything for most preventive services. Remember, preventive services a lot of times are preventive until something is diagnosed, and then it turns into diagnostic. That would not be a $0 premium or $0 service anymore, right? Then it's going to flip to 20%. And then for outpatient mental health services, outpatient hospital procedures, surgeries, durable medical equipment, that's what Part B covers, right? You think of all of these other things we discussed earlier, and we're going to discuss on the next slide. Some blood may be filed as Part B as well. That's going to be 20%. So looking into Part B and the services that are covered a little bit more in depth, right? Here we're talking about some of the major things you'll see in the common services that are covered. Doctor services, especially services that are medically necessary. If you have an outpatient medical and surgical service or supply, right, for approved procedures like x-rays, stitches, and other things, that's Part B. Clinical lab services like blood tests, urinalysis, and some screening tests, Part B. Durable medical equipment, walkers, wheelchairs, canes, other things to help you get around are also considered and covered under Part B. Another common service that's covered, diabetic testing supplies and equipment. So if you think of blood sugar or glucose testing monitors, test strips, insulins, lancet devices, other blood sugar control solutions, diabetic shoes, inserts. A common one recently has been the continuous glucose monitors, also known as CGMs. Those are the devices that you sometimes see on the back of people's arms that continuously monitor the blood sugar. That's Part B. Home health services. So it depends on if someone had inpatient stay prior to needing home health care. If they had an inpatient stay, it's going to be covered under Part A. But if they didn't have an inpatient stay, or the number of home health care services exceeds 100, it's going to be covered under Part B. Outpatient mental health services, outpatient physical and occupational therapy. The list goes on and on. Sometimes prescription drugs, it just depends, right? So this is not an all-inclusive list, but as you can see, there are a lot of services that are covered under Part B. So what's not covered by Part A or Part B? You've got, Medicare doesn't cover everything. And if you need certain services that aren't covered by Part A or Part B, you'll generally have to pay for them yourself, unless you've got other coverage, including Medicaid, to help cover the costs, or you're in a Medicare Advantage plan that helps cover some of these. Some of the items and services that original Medicare doesn't cover included most dental care or dentures, vision for regular prescription glasses, hearing aids and exams for fitting them, cosmetic surgery, massage therapy, routine physical exams. Note that whenever someone's brand new to Medicare, they'll receive a one-time welcome to Medicare visit, which includes a full physical, but beyond that, it does not. It gives an annual wellness visit. If they want to get another physical, it's not covered by Medicare. Long-term care, concierge care, and other covered items or services you get from an opt-out doctor or other provider. These are doctors or providers that don't want to work with a Medicare program. Medicare doesn't pay for those items or services you receive from those opt-outs except in an emergency. And they opt out for a minimum of 2 years, and then every 2 years they can choose whether to keep that opt-out status or to accept Medicare approved amounts on a case-by-case basis. Just to note, in South Carolina, most doctors have not opted out of Medicare. They're in, and what you'll see you may see this be a more common occurrence in the Northeast, Northwest, some places in the South as well. Many other coverage types are going to require you to have both Parts A and B of Medicare. What are those? First of which is a Medicare supplement policy, sometimes known as a Medigap policy. Note that we're going to talk more about these in a separate training video. Please feel free to access that in our resource library. Medicare Advantage plan. Those are very common, but require both Parts A and B. How about TRICARE for Life? That's medical coverage for Medicare eligible uniform service retirees 65 or older, to their eligible members and survivors, and to certain former spouses. CHAMP VA. You still need to have both Parts A and Part B active. And then lastly, employer coverage, as long as you have fewer than 20 employees. If you have more than 20 employees at your employer, then you don't necessarily need to have both Parts A and B active. Many people elect to go with Part A when they first become eligible, and then defer Part B until they're getting close to retirement or when they retire, so there's no gap in coverage. If you're already receiving Social Security or Railroad Retirement Board benefits, you'll be automatically enrolled in Medicare, both Parts A and B, without an additional application. You'll receive your initial enrollment package, which includes your Medicare card and other information about 3 months prior to turning 65 or 3 months before your 25th month of disability benefits. If you're not receiving retirement benefits from Social Security or the Railroad Retirement Board, you must sign up to get Medicare. And how do you sign up? Well, there are a few different ways you can do it. The easiest, if someone is tech savvy, is to go to ssa.gov. It takes about 10 to 15 minutes. Usually takes a couple weeks to process, and then you'll receive your Medicare card. You can also call 1-800-772-1213. That's the National Social Security Office. Or you can call your local office, and you can view on the Social Security website, there's a local office locator. If you retired from the railroad, you need to enroll with the Railroad Retirement Board, and you can call them by dialing 877-772-5772. And don't forget to apply about 3 months prior to your 65th birthday. Remember, too, you don't have to be retired and on Social Security to receive Medicare. So if you're still working, especially if you are working with an employer that has less than 20 employees, you want to be proactive and go ahead to enroll in Medicare ahead of time. So what happens if you didn't sign up for Part B when you were first eligible or during your initial enrollment period? Well, good news is there's something called a general enrollment period. And this is a period, or the GEP, that is every year, and it's from January 1st to March 31st. And you can sign up for Part A if you owe a premium, and or Part B during this time. Your coverage will begin the first of the following month. So if you enroll in Medicare Part B in January, your coverage should begin in February. If you enroll in February, your coverage will begin in March, and so forth. Remember, it ends March 31st. And do keep in mind that if you went at least 12 months of being eligible for Part B and you did not enroll in it and did not have other creditable coverage, like through a large employer or something else, you may have a penalty to pay. Same goes for Part A if you have to pay a premium for Part A. As we mentioned before, let's discuss some coverage options that members can receive their care through. Medicare Advantage and Part D prescription drug plans. So Part C, Medicare Advantage, right? These are health plans approved by Medicare, but they're run by private insurance companies. A lot of these companies you've probably heard of before, and this is where Medicare pays these companies an amount to service each member. So Medicare pays the insurance carrier to take care of the member. It's just another way to get Medicare coverage. Remember, you're still part of the Medicare program. You've got to have both Parts A and B active. And Medicare Advantage plans may use networks of doctors or hospitals. So think of it like an HMO, where you have to stay in network for all of your routine non-emergency services, or a PPO, where you have a broader network and you have the flexibility to go out of network, but you may pay a higher cost-sharing amount. Again, still with Medicare here, Medicare Advantage, right? You're still part of Medicare. You have all the rights, liberties, and protections of original Medicare. You're able to get your Part A and Part B services. You don't show your original Medicare card. Instead, you would show your Medicare Advantage card. Many of these plans also include prescription drug coverage, and they may include some extra benefits like dental, vision, hearing, but do keep in mind that each plan is a little bit different. How much and what they have can vary from plan to plan. For Medicare prescription drug coverage, also known as Part D, you can get that as long as you have Medicare Part A or Medicare Part B. You don't need both. And this is optional. It's not required. However, it's advantageous to get it. These are programs that are run through private insurance companies, similar to Medicare Advantage plans. There is a penalty that could apply if you don't receive coverage when first eligible, assuming you didn't have other creditable drug coverage. Each of these plans have a formulary or a list of covered drugs, and again, these can vary based on the plan, and they can change from year to year, so it's a great idea to revisit this every year. And these formularies also include a range of drugs to treat each therapeutic condition or category. These costs on these plans vary a lot. You can have, monthly premiums from very low to very high. Deductibles and co-payments can be all over the map. Again, there's no one size fits all. Costs can be less if you use a preferred pharmacy over a standard retail pharmacy. And if you have extra help, which is, there are programs out there that can help reduce those costs, called extra help or low income subsidy, it can significantly reduce your cost when you go to a pharmacy or have those prescriptions mailed to you. Again, there are two ways to get prescription drug coverage. One is directly through Medicare, through Part D, and that couples very nicely with a Medicare supplement or a Medigap policy. Or you can get that prescription drug plan built into a Medicare Advantage plan. Those are called Medicare Advantage plans with prescription drug coverage, also known as MAPDs. So how much does it cost this year? It varies by plan. Most people will pay a monthly premium, which again varies by plan, and income if you qualify for extra help. There's a yearly deductible in many cases, not always. Then you have co-payments or co-insurance. So copayment is a dollar amount, whereas a coinsurance could be a percentage of the cost of the drug. And then once you hit $2,000 out of your own pocket, you have very little out-of-pocket expense other than the premium, as long as those prescriptions are covered. If you have limited income and limited resources, you may qualify for extra help to help you pay for your prescription coverage. So what do those phases of coverage look like? Some plans, I mentioned before, have a deductible. In that phase, generally the enrollee is responsible for 100% of the cost until they've met that deductible. And it just depends on the plan. Some plans may not have a deductible. Some plans may have a deductible only on certain levels or tiers of prescription drugs. Then you move into what's called the initial coverage phase. On average, you'll pay about 25% of the total drug cost, but that's not always the case. Some plans you may have very little to no out-of-pocket costs for your most generic drugs, and then as you go up in tiers or levels, your cost could increase, as generally speaking, the cost of those prescriptions in those higher levels are more than those in the lower levels. There used to be a phase called the donut hole or coverage gap. That's been eliminated now as part of the Inflation Reduction Act. So significant savings to consumers, and people go straight into catastrophic coverage. Now, you don't have to worry about paying anything. You just continue to pay your premium, and it's covered at 100%. This chart shows who pays for that. And speaking of charts, here's another one for you. This time it's about Part D as opposed to Part B. But same people are impacted, and this is an extra charge that goes on top of your plan's premium if you have prescription drug coverage, whether it's through a Medicare Advantage plan that includes it or a standalone Part D plan. These are the same brackets as Part B, and they're updated every year. And what happens if you didn't have drug coverage? As we mentioned before, you could get a penalty if you had the opportunity to get drug coverage but didn't, and you did not have other coverage through an employer or through a spouse or through some of the other waivers that are out there. This also takes into account too that you don't have extra help or low income subsidy. And the penalty is always there as long as the coverage is in place. And what does that penalty look like? Well, it's 1% of the national average per month that you could have had drug coverage but did not. So if you went a year and a half without drug coverage, right, that 1% is, let's say, a year and a half, 18 months, you would take the base premium, which this year is $36.78, times 18%, and then add that to your plan's premium. So even if you get a low premium plan, if you have a significant penalty, or in a lot of cases, Medicare Advantage plans may have no premium, and if there's a penalty in place, all of a sudden, there's a premium. And that number can change every year. A couple years ago, the base beneficiary premium was $34 and some change. So it's based off of a percentage, and so that number will fluctuate as the years tick by. And let's spend a second and talk about Medicare.gov, because if a consumer or if you create a Medicare.gov account, it'll streamline a lot of things that can make each year easier for you. You can view, order, and print replacement Medicare cards. A lot of people lose them all the time. You can view, and get your current drug card information. And these are things that your pharmacist needs in order to process the claims, right? So both for prescription drug plans and Medicare Advantage plans, so your clients can get those medications filled even if they haven't received the card yet. You can access and research the drug options. The other thing you can do too is if that your client has been prescribed medications, a lot of times it automatically shows in their Medicare.gov account, assuming they were prescribed these medications and filled these medications while they were on Medicare. So it saves time when doing an annual review for your clients. The other thing you can do too is you can even view your medical and hospital claims. You can pay your premiums if they're not being drafted out of your Social Security check. There are so many things you can do by having a Medicare.gov account. And lastly, I want to close with a message from our CEO and President, Joel Lourie. When you love what you do and you can make a living from helping others, it's not work, it's a blessing. Sometimes they'll say, when you love what you do and love who you do it with, you never work a day in your life. And that means a lot. How many people can you help and make a difference in their lives? Hopefully you found today's webinar very informative. Please do not forget to register for the next in our Medicare training series. You can find this online at our Agent Partner Hub at www.lourieagents.com. From there, click on Events and Webinars, and you will be able to see future trainings available and links to register. Thank you for joining today's webinar, and I have one question for you. Who do you want to partner with? I sure hope it's us here at Lourie Life Health. If you have further questions or would like to discuss further what a partnership looks like, please give us a call. That's 803-256-2067. Again, that number is 803-256-2067. My name is David Goldberg, Agency Director here at Lourie Life Health. Thank you again and have a great day.